Hey everybody, it's Dr. Seiler from Seiler Skin, and today we're going to shoot a two-part series of a patient that's getting a vampire facelift as an alternative to an actual surgical facelift. This is a great patient of ours who's 59, and she wants to see a little bit of lifting in her cheeks to really address a little bit of volume loss and a little bit of skin laxity around her mouth. Really not interested in a surgical lift, and potentially really doesn't need it if this really gives her a great result, which I know it will. So you're going to see us doing this over two different videos. We're going to show the second one with the PRP injections tomorrow, which is what we call our liquid gold. This has all the healing elements in the blood that we take out and concentrate to give an even better result than just the filler alone. So in the first video, we're going to inject some filler. We're going to use Voluma and Juvederm. We're going to use some Voluma up in the cheeks here and under the eye to really give her a nice natural lift. And then you'll see that we'll inject some Juvederm around the mouth, pretty typical for our filler injections. And then in the second session that you'll see tomorrow, we're going to flood the entire face with the PRP to help stimulate collagen, help with the deeper fat pads, and help to give an even better result than the filler alone. So we're going to start injecting under the eyes. Again, this is Voluma. This is one of the thickest fillers made, so it's great to treat under the eyes. My lovely assistant Kayla is going to do a little bit of icing for me just to kind of further numb the skin. We've already put a little bit of a topical numbing cream on, so that really helps to numb the skin. Generally, patients don't feel much at all with this. She's got great skin, so I know she's going to do really well with this and tolerate it. We use this little device called the AccuVein that shows me where all the little blood vessels are on the skin, so it really helps me miss those. So not only do we not damage those structures, but we keep from bruising the patient. So all right, first little stick here. You may feel just a little bitty pinch. You should be pretty good numb. I feel okay? Mm-hmm. This is a good filler to use under the eyes if the patient has enough thickness of skin and tissue to really get under. So this actually goes pretty deep to kind of get under all layers of tissue to really give a nice little lift. And you don't have to put much. Usually we only put about 1/10 to 2/10 of a syringe under the eye here. And you'll see this will pop it up really nice. We're going to have great before and after pictures on her. And even though this is a pretty vascular part of the eye, with using that AccuVein, we usually stay away from little blood vessels and keep from having any bruising. Sometimes we stick the patients multiple times with all the different areas we're going to inject, and patients are really surprised that in my practice the risk of bruising is incredibly minimal, even if they bruised before having been injected somewhere else. So my bruising risk is pretty minimal. You hurting at all?
Not at all.
Good. You can see that we put just a little bit of filler under the eye there. And now we're going to kind of come up here on the cheek. Let's ice up there a little bit. So what other questions do we have about the vampire facelift that I haven't covered?
So tell us about you training other practitioners on the vampire procedures.
Sure. So all of the vampire procedures use what we call platelet-rich plasma, which we obtain from a small little blood draw, a little needle stick. It's really pretty painless. About the same amount of blood that you would give at an internal medicine doctor's office to get your labs checked on a yearly basis. But we use an FDA-approved system, so for you to really do the vampire procedures correctly, especially the vampire facelift, any injector has to come to a certified trainer so that they become certified to provide these treatments. Unfortunately, there are people that do these treatments that are not well trained and are using the name when they're not really certified to do it. So for those injectors out there, you really want to make sure that you take a certified training course to do this correctly. This is a great treatment to add to your practice if you're already doing filler. The results are significantly better with the injection of PRP in addition to just the filler alone. We don't really change much with where we put in place filler and what fillers we use. We just add PRP to it to give a better result. I have found in my practice that in most patients, we don't have to put as much filler in because we know that the PRP is going to give extra lifting and tissue expansion. And lots of times we can treat under the eyes now with just a little PRP injections without having to put much filler because that's a pretty difficult area to really completely correct with filler alone. That's the under eye area. So we're just focusing on lifting up the cheek here a little bit. It's really important if you are injecting to really understand what filler to use and where on the cheek to put it. I see all the time that you always hear me in training videos talk about millimeters and angles, and really you can put a put filler in a millimeter too deep or superficial, a millimeter too high or too low, and completely change the result from a positive to a negative result. So it really needs to be done in expert hands.
Dr. Seiler, how do you assess the face as far as where you put the filler?
Yeah, great question. So there's multiple different anatomical things that you look at. You look at the proportions of the face. You use a ratio called the golden ratio. You hurting at all? Feel anything? Good. The golden ratio of 1.6 to 1. So you can do measurements in your head or even with an eyebrow pencil when you first start doing it to really understand where the angles of the cheek should be, where the proportions should be. We use things like Hinder's lines in the Marquardt face to really kind of map out where everything should be and what's possible in the patient, so that we can take a patient, like she said earlier, that she was really excited to look 5 years younger instantly. So those are the way that we really assess where we need to put filler. All right, so now we've finished putting just one syringe of volume in the cheeks, half a syringe on each side. We've got a nice lift here, which we were able to see right away. That's the beauty of using Voluma. Now we're going to use a little bit of traditional Juvederm around the mouth. We've already kind of iced and used our AccuVein, so I do this little wiggle that helps just kind of distract the skin a little bit so they don't feel it too much. It's a little harder to pick this up on camera because this is a filler that expands, so that actually the results from this filler are much better after about 4 weeks when it thickens. This is a filler that has a lot of water affinity, so it will actually kind of expand kind of like a sponge. So it's a great kind of volumizing and tissue bulking filler that we use. So we're going to do this around the mouth on both sides. And then stay tuned for tomorrow and you will get to see the video of us injecting the PRP everywhere, which literally tops off the vampire facelift, and we'll see great results from all of it.